Hello, my name is Amanda Colapelli. Welcome to Dermadry Segments. For the episode today, I'm joined by Dr. Hope Michelle. Thank you very much for having us today.
Thank you for having me.
So just to go into a few of the questions, we founded Dermadry because it was our desire to help people. What was your motivation to enter the field of dermatology?
Well, my motivation was very similar. I am the product of a nurse. My mother was a nurse. And from a very young age, I watched her help many people. And I remember her asking me, what do you think you want to be when you grow up? And I was about 12 or 13, and I had no idea. But I knew that I loved to read and to study, and I was a very independent student.
Mhm.
And she said to me, she said, I think you have what it takes to be a doctor. I think that you can help many. You love to read, you love to research, you're very inquisitive, you're always asking questions, and I think that's what you're going to be. You're going to be a doctor. And the rest was history, and ever since then, I have advocated for my patients, through reading and learning and educating them about every condition that they come to see me about.
Mhm. Wow, that's awesome. When you were studying to be a dermatologist, did you learn specifically about hyperhidrosis in school?
I did. I did. We absolutely learned in dermatology training, there are over 3,000 conditions of the hair, skin, and nails that we have to learn about. And we actually go through all of the material every year. So it's like we're preparing every year times 3 years of residency to do what we do. And what I found, with hyperhidrosis is that it actually was more common than people led us to believe.
Hmm.
And even back then and still today with hyperhidrosis, a lot of the diagnosis is made kind of incidentally. What I find in my practice is that people come in for one thing, and
Hmm.
I'm the one that notices that they have hyperhidrosis. They may come in for acne or a full body skin exam,
Hmm.
and the table exam paper has been moistened,
Hmm.
when they get up. And so it was common back then, but I didn't see nearly the number of people that I see coming in to talk to me about it today.
Hmm.
So back then, I really didn't have anyone coming in and that being the main reason why they scheduled an appointment to see me.
Okay, well, that's really interesting. Why do
hmm
you think the reason is that a lot of people have hyperhidrosis, or why is it such a taboo?
it's really hard to say, but I do know that there's still many people that don't know that it's a medical condition.
Hmm.
A lot of people suffer in silence. I know that there may be adolescents that may say something to their parents, but their mom or dad may say, your body is changing.
Hmm.
That's normal.
Yeah.
That will go away. I also know that, although it runs in families, it's not discussed. It's a condition that I think a lot of people live with in silence, unfortunately. I know that, it can be embarrassing. I know that it can be dismissed, and maybe some people, until, luckily today, we have a lot of information online, and I think more and more people are figuring
Hmm.
it out. But I'm not quite sure why we still don't get a number of people coming in to seek treatment for this condition.
Exactly. Speaking about that, what is the typical hyperhidrosis patient that when they come in, what do they typically have as symptoms?
I think, when they come in, they talk about the social or the emotional anxiety that surrounds the condition. I
Hmm.
think that's what drives them in,
Hmm.
the fact that
Hmm.
they're avoiding social gatherings. You
Hmm.
know what I mean? There may be parents that bring in children, and talk about the fact that, they have body odor,
Mm-hmm.
and we're just not quite sure why they have that odor.
Mm-hmm.
And not really thinking, I think, making the connection to the fact that it could be a condition that's doing it,
Mm-hmm.
but really thinking more so that they're not cleaning themselves well, or they're not showering enough.
Mm-hmm.
We also have people that suffer from stress and anxiety and depression about it. And I think that one way or the other, they come to the understanding, look, I have to figure out what's going on, and I have to find a way to get past this because it's becoming disabling.
Mm-hmm.
It's impacting my ability to, even date, to go out with people, to be in public, to do the work that I've been, employed to do,
Mm-hmm.
presentations, all of that.
Mm-hmm.
So I think it's just all of that, comes together, and it finally drives these patients into the office.
Mm-hmm. Yeah, there's a lot of research that was done, psychological based, and those were exactly the reasons that came out. A lot of patients were anxious,
Hmm. Hmm.
anxieties, and then that develops another condition. So they are linked together, and there's been a lot of studies that have shown that.
Hmm.
Um, so it's interesting to also see your aspect on how they're brought in together. But I believe it is a taboo, and that's also why Dermadry, we're trying our best to spread the word, and
Hmm.
also allow people to understand that it's okay to talk about it, and also make them feel comfortable that there's a product out there to help them as well.
Exactly. And
Mm-hmm.
that's so needed. It's really needed. And that's what's impressive about research. A lot of studies that I look at that have been most impactful for me have been like those survey type studies,
Mm-hmm.
or those retrospective where people are given surveys. The amount of information that you can get from those
Mm-hmm.
surveys, that people have been living in silence with the condition, some for 10 years, before they've decided to seek treatment.
Mm-hmm.
And then when they did reach out for treatment, they may have seen some of my primary care colleagues who really didn't know much about it either.
Mm-hmm.
And so that may have been discouraging for them in terms of, continuing that journey to find treatment. And
Mm-hmm.
then the quality of life questions that are asked are just amazing. The responses
Mm-hmm.
from how hyperhidrosis can affect quality of life.
Mm-hmm.
It can be debilitating.
Mm-hmm. Yeah, that's very, very true.
Hmm.
How do you think hyperhidrosis and wellness routine fit into women's wellness, or fit into how women do sweat more? Is it males that sweat more? Is there research that you've seen that could go into that?
Well, for some reason, I don't know what it is. It's like men can sweat and it's not as huge of a deal as it is for women. I think in terms of the wellness of women, I think that once you have hyperhidrosis, we know that there's no cure for it, but you can live with hyperhidrosis with a quality of life that's acceptable.
Mm-hmm.
And what I educate my patients about is just always be kind to yourself. Figure out what you can do that can help promote wellness in your life and your lifestyle.
Mm-hmm.
So, for example, if cleaning your home brings out a sweat in you, and that bothers you, then maybe consider hiring a cleaning service. Think about moisture wicking clothing that will allow you to have better rest at night.
Mm-hmm.
I mean, we all need rest.
Yeah.
And to not be able to get that because you're breaking out in a sweat and you're moist and you're uncomfortable is not a good thing. Don't not exercise because you're embarrassed about being in the gym. Maybe consider working out at home, maybe bringing in someone that you can do that can train you,
Mm-hmm.
or a friend that you can work out with. So I think in terms of wellness, I think once you know you have this condition, I think that there are different tiers of things that you need to do to address it. You know, right? Obviously, you were going to talk about treatment, but we have to talk about wellness. We have to talk about what can I do to be well with this condition.
Mm-hmm.
You know, it's not acceptable for me to ruin all of my clothes. It's not acceptable for me to not be able to sleep at night or not be able to be around people.
Mm-hmm.
So I think, you know, thinking about things in that aspect will help alleviate some of the stress and anxiety that may surround wellness.
Mm-hmm. Which is very, very true.
Mm-hmm.
Um, Without giving any names, could you give examples of what obstacles your patients with hyperhidrosis have lived or gone through? Have you encountered any stories in some way?
You know, in terms of obstacles, I think that, you know, the biggest one that I hear about when I ask people, because I do
Mm-hmm.
ask my patients, you know, tell me how this has impacted your life. You
Mm-hmm.
know, give me an example. Because there are times when I need to advocate for my patients
Mm-hmm.
and I need to be able to, if I have to send off a prior authorization or documentation, I want it to be from the patient's perspective.
Mm-hmm.
And I think the most common would be intimacy and relationships with others,
Mm-hmm.
dating, you know, being afraid to hold hands, you know, with your partner, especially when you're first meeting people. It has greatly impacted teenagers, you know, with wanting to go out and be around other people. And as I had indicated, I get a lot of patients that come in concerned about body odor,
Mm-hmm.
you know, and what can I do about that? That tends to be some of the most common stories that I hear. The others would be just work, you know,
Mm-hmm.
my ability to perform at work. You know, no one wants to break out in a sweat all over their forehead or wants to have sweat stains,
Mm-hmm.
you know, on their clothing. And I have had several people that have come in and have talked with me about that.
Mm-hmm. When it comes to clothing, what do you recommend to stay away from, and what do you recommend to stay with, even in wellness side?
I think cotton clothing would be best.
Mm-hmm.
I always recommend lighter clothing in color and in weight. I think that that's really important. I think layering is important. You know, as we switch seasons, it could be quite difficult
Yeah.
trying to figure out what to wear, especially like, you know, when it's going from spring to summer or
Mm-hmm.
fall to winter. You know, it's colder in the morning. You know, how do you dress? And so I do quite a bit of education
Mm-hmm.
about layering, you know, and the ability to be able to remove a top layer very quickly, you know,
Mm-hmm.
when you feel that warmth
Yep.
start.
That's a really good point, and I
Mm-hmm.
feel like especially in now we're going to the winter season, it's really important too because now let's say if people are taking public transportation, you know it gets warmer, then they have to take off their coat, and there's so many layers. So it's really
Mm-hmm.
important that I think we need to take like an understanding of
Exactly. Mm-hmm.
what
It's
are
all about being proactive, right?
exactly
You
exactly.
know, I think, and it's the education that we provide is critical. I mean, that's part of the consultation when people come into the office. You know, we start out by, you know, hearing them out. Let's
Mm-hmm.
just hear, you know,
Yeah.
how does this show compassion? You know, how does this impact your daily living and well-being? And once we receive that information, in my practice, we talk about ways to approach, you know, different facets of their concerns.
Mm-hmm.
Hmm.
It's a good aspect, like a good approach to that.
Hmm.
What are your thoughts on tap water iontophoresis, such as Dermadry, as a treatment option for hyperhidrosis?
I think it's a fantastic option. I love iontophoresis for my patients who have palmar and plantar hyperhidrosis, especially.
Mm-hmm.
You know, that is, you know, it works well for axillary,
Mm-hmm.
but let's be honest, you know, the palms and soles can be difficult to treat with perhaps conventional treatment. And so it actually is my number one recommendation for palmar and plantar hyperhidrosis. I think that it can be effective. I think we have to talk our patients through the consistency in the beginning, sticking with it, and letting them know that if they do stick with it, you do start to see results depending upon severity. It can be anywhere from 2 weeks to 3 weeks or 4 weeks in, but you do get to a point where you can continue the treatment on a maintenance schedule. It's very easy to use. And I always tell my patients, when you're doing the 15 or 20-minute treatments, gosh, you can do it in front of watch a movie, or, could read on your computer. I mean, we're doing everything on our devices right now. And I think, our mindset is, let's get in front of a device anyway.
Yeah.
So I like it.
So we're so happy to hear that. And that's exactly what we say as well. There's a lot of patients that come up to us and say, "Oh, we could watch television while using it," and they love that it's an at-home treatment as well. So it works on both ends.
Right.
Yeah.
Yes, it's an at-home medical treatment that is FDA approved in the United States now, and in a lot of countries. And so people love to hear that. They feel like it's a safe treatment.
That's amazing.
When they hear, it's been cleared.
What patients is iontophoresis fit for, or when a treatment is prescribed for hyperhidrosis patients?
Well, we do have to take a medical history when we see patients, of course. That's part of the evaluation. And so patients that may have a pacemaker, patients that may have underlying conditions like seizures or cardiac arrhythmias are not going to be suitable for this treatment. However, just about everyone else, especially those with moderate to severe hyperhidrosis, are a great fit for this treatment. What I find is that even if I have patients that have palmar hyperhidrosis, I always check the feet. I take a look at the feet, and I talk to the patient about the fact that it can occur there. And so any of my patients that even have it there, if they have an infection on their feet, we always treat that first, of course. But it doesn't stop them from being a candidate. Patients that may have athlete's foot or open skin or anything like that, of course, we would address it first. And once we get past that, then those patients would be, suitable to start the treatment. So outside of any of those medical conditions, just about anyone would be a candidate for Dermadry or iontophoresis.
Good. That's it's true, and that's the aspect our approach as well. And what you're saying, it really matches our values as well on when we look for a candidate and we fit for the candidacy. We really make sure that both ends match. When it comes to misconceptions, what are the largest misconceptions about iontophoresis?
I think, I don't want to be funny, but I think people think of it like, is that electrocution? Is that like that electricity through water? Is that safe? I get that question a lot. And of course, I have to reassure them that, this is low energy, it's a power source, it's safe. But that's probably, my biggest question. And then followed by, will I have persistent numbness? Is that going to alter my ability to have sensation, in that area? And of course, I have to reassure them about that. Other than that, I don't get a lot of questions, but those are probably my most common, comments or questions about the treatment.
Yeah, when it comes to even sometimes there's like redness that comes from the palms. However, it also depends on how mild the hyperhidrosis is. But a lot there people tend to have these misconceptions. However, it's super easy and safe to use, and these redness, it really depends also on how fair your skin is or how
Hmm.
sensitive you may be, but the percentage is very slim as well.
Yeah, I agree with you. The redness, there may be blisters, small, very tiny, rare, that are transient,
Mm-hmm.
meaning that they go away. Maybe some mild discomfort that goes away. I've never had anyone, tell me that they wanted to discontinue treatment because it was uncomfortable. But very rarely will I hear that, but not common.
When do you hope to see future in terms of developments in treatments and research for hyperhidrosis?
I still want people to know this is a medical condition,
Mm-hmm.
right? I mean, we can rely on research for treatments, to show us that they're safe and,
Mm-hmm.
and all of that. But we still have a lot of patients that are not aware that hyperhidrosis is a medical condition,
Mm-hmm.
and that there are safe treatments. I also would love to see there be, um, you know, ways to get adolescents treated.
Mm-hmm.
You know what I mean? I have seen even children with Palmer hyperhidrosis,
Mm-hmm.
and it can happen. It can start in childhood. And a lot of the devices or I know Dermadry is 13, approved for 13 and up, but we know that this condition starts even younger.
Mm-hmm.
So, and I would love to see more for that category for the children. But overall, I would say more education, getting the word out, studies that show that this is safe and effective treatment.
Mm-hmm.
We can never have enough of that. We can't have too much of that. So I would love to see more studies.
Mm-hmm. Have you, in your past 20 years, um,
Hmm.
was there any recommendations or tips that you would recommend to all the patients when it comes to hyperhidrosis? Was it always focused more on the clothing, or just giving them tips and tricks also with anxieties? What have you done in your period of 20 years to help them, give them like little tips and tricks?
When I first started, we didn't have much in our treatment algorithm. And so what I find is that, I completed dermatology residency in 1998. And at that time, we had antiperspirants, as an option. And then iontophoresis was an option, that I did recommend back then.
Mm-hmm.
But, as we move forward, it's very exciting to know that we have more information and I can educate my patients in terms of lifestyle changes,
Mm-hmm.
in terms of combining treatments.
Mm-hmm.
There are times when we use more than one
Mm-hmm.
treatment. So, I don't think there's anything wrong with using iontophoresis in combination with antiperspirants. I do have patients where I combine those treatments,
Mm-hmm.
and I think that it's very beneficial. I think empowering patients, in terms of, building their confidence through
Mm-hmm.
the fact that you can be treated.
Mm-hmm.
You are not alone. There are societies that are strong, and provide support. And so I often recommend that my patients also join like the Hyperhidrosis Society.
Mm-hmm.
And that's very exciting, to have people be able to join platforms like that.
Mm-hmm.
I think overall, to me, what's most important is not only to provide safe and effective treatment, like what Dermadry provides, but to educate and empower our patients so that they know that they can achieve dryness,
Mm-hmm.
right? And they can be confident
Mm-hmm.
being who they are.
Mm-hmm. That's the most important important thing. And
Mm-hmm.
also, when it comes to making them feel confident again, that's also a great aspect that you bring in your practice. You
Mm-hmm.
always try your best to understand the patient and understand and help them to get where they want to be and make them feel comfortable again. And that's great on your practice.
Mm-hmm.
Now, in spite of COVID, when it comes to COVID-19, was it difficult when it came to meeting with patients, speaking about hyperhidrosis, but also speaking about in general, just meeting your day-to-day life? Has that affected anything with COVID?
Well, initially, yes, we all had difficulties, right? We all had to pivot.
Mm-hmm.
I think we all had to, like, you know, sit down, have a moment, and
Mm-hmm.
pivot.
Mm-hmm.
And telemedicine, in my opinion, has been a lifesaver. Even us meeting today
Mm-hmm.
through the way that we're meeting is a lifesaver.
Mm-hmm.
And I think that it provides us with the opportunity to still stay engaged with our patients and still be able to help them.
Mm-hmm.
In terms of a diagnosis like hyperhidrosis, we don't have to see patients in person.
Mm-hmm.
I mean, we understand, we can see it.
Mm-hmm.
And even if it's not to the extreme at the visit
Mm-hmm.
that impacts the patient, we still get to receive the history from the patient.
Mm-hmm.
And so it hasn't stopped me from being able to treat my patients, which is what we want to do, right?
Mm-hmm.
We started out by saying we want to help people.
Mm-hmm.
And so telemedicine has been fantastic. It has been phenomenal in terms of being able to connect with people all over the country and not even in the country.
Mm-hmm.
I've had meetings where I've talked with people that are not in the country,
Mm-hmm.
right? And so I think that for me, it has been a great tool, a great resource in allowing me to stay connected.
That's amazing. I feel like, especially now, this is where we all need humanity the most. And
Mm-hmm.
that's something that we want to bring up with everyone, with work employees, with clients, with dermatologists, doctors that we work with. We really want to make sure that everyone, especially during this time, is going with that and we're able to check in with each other and not just
Mm-hmm.
speak about like it's also about the treatment but also on how you're doing physically, emotionally, and we feel like that's really important.
I agree. Absolutely. Mm-hmm.
Thank you very much for meeting us today. It was a pleasure to go through some questions with you. We're really excited that you like Dermadry and that you recommended to your patients, and we're really, really happy to have spoken to you today.
Thank you so much for having me.
Have a great one.
You too.